Eating disorders are defined by the negative behaviours they cause people to have about themselves, their eating, body shape, and weight. They can cause people to adopt restricted eating, binge eating, and compensatory behaviours. According to NHS data relating to Finnish consultant episodes through 2021 and 2022, there were over 42,000 cases where the primary or secondary reason for admission was linked to an eating disorder. 15 to 19-year-olds were the age group most heavily represented, accounting for 40% of all episodes. To raise awareness of the impact and the supports available, Eating Disorder Awareness Week takes place every year during the last week of February and the first week of March. It aims to fight the myths and misunderstandings surrounding eating disorders, including anorexia and bulimia nervosa, binge eating disorder, and this year's focus, avoidant restrictive food intake disorder, commonly referred to by its acronym ARFID. ARFID is a mental health condition where people don't eat enough food or don't eat enough different types of food to meet their energy or nutritional needs. Some of the reasons why a person with ARFID might avoid or eat less food include sensory aversion due to being extremely sensitive to the way that food tastes, feels, smells, or looks, fear of consequences such as choking, stomach aches, or constipation, which in turn might be dealt with by only sticking to foods they feel are safe. Lastly, it could also be caused by a lack of interest in food. That's because for some people, eating can feel more like a chore than a pleasure, which makes it a challenge to eat enough to stay well. The way that one or more of these symptoms can combine, alongside their severity and impact, is unique to the individual. Because of this, ARFID can look very different from one person to another. For example, someone with ARFID could lose weight and become malnourished, making them tired, weak, and unwell. Due to not eating enough to get the nutrients the body needs, they may also experience anemia, rickets, and osteoporosis. People with ARFID can also experience increased levels of anxiety when they eat or think about eating certain foods, which can also lead to difficulty in social situations. It is also a more common experience for autistic people. One of the reasons for this is because the brain of an autistic person receives and processes information in a different way to their neurotypical counterparts, which can make eating some types of food especially difficult. That being said, if an autistic person happens to have challenges with eating, that doesn't necessarily mean they have ARFID. So how, you might be asking, is ARFID different to more well-known eating disorders such as anorexia and bulimia nervosa? Long story short, people with anorexia or bulimia tend to think more about their body size or weight, which in turn has an impact on what and how much they eat. ARFID, on the other hand, is not directly linked to the way the person feels about their weight or body size, which is important to know because the treatments are different. Professionals will usually focus on fixing any physical health problems first. This could include the use of multivitamins, mineral supplements, and medication to increase appetite, alongside working out which foods a person is avoiding and why. Psychological treatments, on the other hand, can also include cognitive behavioural therapy, which is a type of talking therapy that can help a person to learn more helpful ways of thinking and reacting to challenging situations. Graded exposure, for example, is a type of CBT technique that can be used to help a person with ARFID change the way they act around food. Foods are ranked by how much anxiety they cause, and the person will work with a therapist to make a plan to try these foods. They do this by setting realistic goals and are given the tools to help manage their anxiety along the way. Other behavioural approaches include a technique known as food chaining, which involves finding a food that someone is able to eat and slowly introducing foods that have a similar sensory quality. Lastly, the family-based approach takes into account the fact that parents and carers are often the main source of support for someone with ARFID. Family-based approaches include upskilling other members of the household to better support the person in question, a focus on better structure and routine around mealtimes, alongside sharing ways to deal with anxiety. For more information on the use of cognitive behavioural therapy for avoidant restrictive food intake disorder, this book, authored by Jennifer Thomas, the co-director of the Eating Disorders Clinical and Research Program at Massachusetts General Hospital, is the first of its kind to offer specialist treatment specifically for ARFID. It compiles detailed information, workable steps for treatment, alongside real-life case studies for the benefit of clinicians, parents, and carers alike. There's a link in the description if you'd like to check this book out in more detail. Finally, please remember that due to stigma, lack of awareness, and the fact that eating disorders present very differently from one person to another, they can often take a long time to diagnose correctly. This means the sooner a person can access professional help, the better their chances of recovery. If you or anyone you know is experiencing the symptoms of ARFID or any other eating disorder, please contact your GP. And if you got value from this video, don't forget to subscribe to this channel and join us as we continue to deliver content that makes the conversation about mental health, well-being, and inclusion more accessible.